A double chin is nothing to sneeze at. It can affect your looks, your confidence, and your well-being. Well, now there are some new non-surgical procedures that can be done in a doctor's office to fix that dreaded double chin. Here to tell us more is Dr. Cameron Roxar, a founder of the New York Cosmetic, Skin, and Laser Surgery Center with private practices in Manhattan and Long Island, and an associate professor of dermatology at Mount Sinai Hospital. Dr. Roxar, so good to see you. What causes a double chin? I think a lot of people believe it's just due to being overweight, but it's not just that, is it?
Certainly being overweight has something to do with it. If you're overweight, some people do accumulate fat in what we call the submental area, and we call that submental fullness.
But I've seen lots of skinny people with,
You're absolutely right. There's certainly genetic variations from person to person. There are people who have just trouble areas, and one trouble area happens to be, underneath the chin, what we call the double chin or submental area.
How much does bone structure have to do with it?
Bone structure doesn't have a lot to do with it in a sense that, people have different bone structures, but, it is actually an accumulation of fat.
Right.
When you actually you will feel fat in that area.
Right. So in the past, what are the ways that people had to deal with it? Was it just through surgery?
Traditionally, the way we've dealt with fat in the submental area has been liposuction. I mean, there's been various improvements in liposuction where it's gone to a minimally invasive procedure from like a procedure where you did under general anesthesia. But regardless, it is surgery where we actually put little holes and we suck the fat out through those holes.
Okay, great. Now you have two new treatments that you perform in your office. Tell us about those and how they work.
Well, the first one is Kybella. Kybella is kind of a revolutionary procedure because it's the first drug of its kind that actually melts fat.
Wow.
It's been under development for 10 years and it's finally FDA approved. And actually what the drug does is actually breaks down the membranes of the fat cells, and then the body's inflammatory cells come in and they take away the broken down fat cells.
So in that video, you're just injecting the Kybella. It's breaking down the fat cells, which will then be flushed out of the body.
That's right.
And what is the downtime for something
The
like
downtime with that is, you can have a couple of days to a couple of weeks of swelling, depending on how much fat you have in that area. Obviously, the heavier you are, the more swelling you'll have because that's the body's way of getting rid of the fat cells.
Right. So you do have to be aware of that. Is it painful? Is the treatment?
It's not painful because we do numb the area with numbing injections before we administer the Kybella. It's not something that you really need to take time off from work. The swelling is worse the next day a little bit.
You can Perfect time to do it.
This is a perfect time to cover it.
Now, tell us about cool sculpting.
Cool sculpting has been around for 6-7 years, and cool sculpting is a device that takes the fat in a certain area through a cycle of cooling, and it's been shown that you can cause selective injury to the fat cells by cooling them down. So right now, the areas that we treat is abdomen, waist, and the thighs, and recently a new handpiece got FDA cleared, which can actually attach to the chin area, to under chin area.
Is that what this is? It attaches right under the chin,
exactly.
This part here?
That's the attachment. You actually attach it under the chin, and then the machine takes the area into various cycles of cooling and thawing, and that process injures the fat cells, and again, the body's inflammatory cells come in and take away the dead fat cells.
Similar recovery period for this?
Similar recovery period.
So who would you recommend Kybella, and to whom would you recommend cool sculpting?
They're both, usually a few sessions. I tell patients it's 1 to 3 sessions, and it's they're both for people who have fat, but they don't have a whole lot of skin laxity. If you have a whole lot of skin looseness, then we may have to combine it with other procedures to actually tighten up the skin as well.
So which one has longer results?
They're both similar in a sense that they do cause permanent injury to the fat cells, and the fat cells do go away. So this is not something that the fat cells just come back. Obviously, if you gain a lot of weight and the body finds a way to restore the extra calories you're taking, it's going to restore it somewhere
else, right?
So it's going to find somewhere to put it, But as long as you maintain the same weight with these type of procedures, your results are long-term.
Right. Now, what do these procedures, how much do they cost, roughly?
Depends how many vials we have to use. Let's say for Kybella, if it's a large area, a smaller area, it could be anywhere from $750 to, $1,500 to $2,000, depending how much material we have to use.
And do you have a favorite between these two treatments?
I like them equally well. Kybella is faster in the sense that, with the cool sculpting, you do have to sit with the device for a period of time. Kybella is quick because I can just come in, I numb the area, and I do a bunch of quick little injections, and you're out of the office. And
there's something coming that's not yet FDA approved, but you think has potential as well?
Yeah, there's a new device called Sculpture. Sculpture is a device that uses a laser, diode laser, to actually injure the fat cells, and it is non-invasive also. It's an attachment of a device to an area. The areas that we're treating right now is abdomen and the waist area, but potentially down the road, I can see how that could get fitted to the under chin area as well.
All right, Dr. Roxar, Thank you so much. These all sound very useful. Let's hope we don't get double chins just yet, but when we do, we know where to go. Thank you so much.